Distinguished guests, ladies and gentlemen, please kindly make your way to your seat as our event will begin shortly. Thank you for your cooperation. Hadirin berbahagia, sesaat lagi acara akan segera dimulai. Kami persilakan Anda untuk menempati tempat duduk yang telah tersedia. Distinguished guests, ladies and gentlemen, please kindly make your way to your seat as our event will begin shortly. Thank you for your cooperation. Hadirin yang kami hormati, Kepala Badan Pengawas Obat dan Makanan Republik Indonesia bersama para tamu kehormatan memasuki ruang acara. Ladies and gentlemen, we are pleased to welcome the Chairperson of the Indonesian Food and Drug Authority. Ladies and gentlemen, to kick off our event, I'd like to ask you to please rise together. Let us sing Indonesia National Anthem. Bapak dan Ibu hadirin sekalian, mohon ketersediaannya untuk sama-sama menyanyikan lagu kebangsaan Indonesia Raya. Hadirin dimohon berdiri. Hadirin dipersilakan duduk kembali. Thank you ladies and gentlemen, you may be seated. Assalamualaikum warahmatullahi wabarakatuh. Shalom Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Good morning and welcome to the opening ceremony of 16 WHO International Regulatory Cooperation of Herbal Medicine Annual Meeting 2025. It's such honor for me to be your master of ceremony of today. My name is Chika Audika. And before we begin, allow me to warmly welcome with the highest respect the chairperson of the Indonesian Food and Drug Authority, Professor Taruna Ikrar, MD and Biomed PhD. The IRCH Chair, Dr. Kim Sung-chol. The IRCH Vice Chair, Dr. Neil Gower. The Director General for Pharmaceutical and Medical Device in Ministry of Health Republik Indonesia, Dr. Lucia Rizka Andalusia APTM Pharmas. The Dean of Pharmacy, Faculty of Indonesia University, Professor Ari Yanuar. The Dean of Pharmacy, Faculty of the Republic of Indonesia Defense University, Professor Yahdiana Harahap. The Dean of Pharmacy, Faculty of Erlangga University, Professor Dewi Melani Haryadi. The Dean of Pharmacy, Faculty of Hasanuddin University, Mr. Abdul Rahim, PhD. Participant from Academy, team of WHO's Traditional, Complementary, and Integrative Medicines, colleagues from Ministry and Association, delegates from IRCH members country, observer country, and participants, and also welcome to the distinguished guests for coming this special event. Ladies and gentlemen, International Regulatory Cooperation for Herbal Medicine was established in 2006, bringing together regulatory authorities from all around the world with one shared mission to strengthen collaboration, improve the safety and quality of herbal medicine, and raise awareness about their safe use for better health for a worldwide. So ladies and gentlemen, in these years, we are proud to host this important meeting here in Jakarta when experts, regulators, and key stakeholders come together to share ideas, exchange experience, and work hand in hand to play a strong and safer future for herbal medicine. So ladies and gentlemen, to knowledge deeper about the International Regulatory Cooperation for Herbal Medicine, please welcome the WHO Secretariat, Mr. Pradip Dua, to spell out the related information. For him, the time is yours.
Very good morning, ladies and gentlemen, and welcome to this 16th WHO International Regulatory Cooperation for Herbal Medicines annual meeting. It is nice to see a full house, and it is nostalgic to remember the last meeting which happened in Istanbul in April last year, and to see the family growing is really overwhelming. Ladies and gentlemen, I am sure that session will unfold all the details about this session, about this two-day meeting. But at the same time, it would be noteworthy to mention here that WHO has recently rolled out a new WHO Global Traditional Medicine Strategy to guide the whole world for the next decade, 2025 to 2034. And as a part of this new WHO Global Traditional Medicine Strategy, one of the 4 strategic objectives focuses on the aspect of regulation. Regulation not only for the traditional complementary integrative medicine products, but also for the practices and the practitioners. And what more can be an appropriate forum than WHO IRCH, where we see the regulators, the National Regulatory Authority representatives from across the globe. And it is indeed overwhelming to see the dignitaries present with us, and this shows the commitment of the government of Indonesia towards effective regulation for TCI products to ensure the availability of quality, safety, effective, and accessible products to the mankind. So with this brief introduction, I would like to start the proceedings for this opening session. And to begin with the session, I would like to invite Dr. Neil Gover, who is the Vice Chair for the WHO IRCH Network, for his welcome address. Dr. Neil.
Thank you, Dr. Dua. A special welcome is extended to our esteemed host, Professor Taruna Ikrar, Chairperson of the Food and Drug Administration, Indonesia, and Dr. King Sang Chol, Unit Head of TCR, WHO, and Chair of the IRCH. Selamat datang di Indonesia. Welcome everybody to Indonesia for the 16th annual meeting of the International Regulatory Cooperation for Herbal Medicines. Already you would have experienced the warm hospitality and excellent hosting provided by the Indonesian Food and Drug Authority. Thank you to the FDA Indonesia for all their organization and efforts in staging this event, particularly Dr. Muhammad Kashuri. Thank you also to the WHO staff members, Drs. Yunhu Shen and Pradeep Dua, and for all their tremendous support in administration and organizational efforts. The network of national and regional, sub-regional regulatory authorities responsible for the regulation of herbal medicines was established in 2006. The terms of reference of IRCH for what was then an informal volunteer network was amended before members of the IRCH agreed and decided upon their formalization as a formal network of WHO, and this was done in 2016 to 2017 and was finalized in 2018 as a formal network supported by WHO. The 16th annual IRCH marks an important conclusion of a transition from an informal network of regulators facilitated by WHO to being this formal network of WHO. And this has occurred in conjunction with a number of other pivotal events that have taken place in the last year. Despite this formal network having been established in 2018 as a structure of WHO, its terms of reference and steering group have meant that we still needed to put into place its core heartbeat, which was the working groups of the IRCH. In the last year, the WHO has guided the reformulation of the terms of reference for IRCH itself, but also, very importantly, the new terms of reference and establishment of 3 working groups of IRCH. These are the quality and sustainability of herbal medicines, the efficacy and intended use of herbal medicines, and safety and regulation of herbal medicines. Importantly, this has led to the successful hosting of 3 IRCH working group workshops before this annual meeting in August 2025. Workshops for Working Group 1 on safety and regulation and Working Group 3 on efficacy and intended use of herbal medicines was held as an in-person event in Delhi, India by the Working Group Lead, India. From the 25th to the 26th of August, the WHO IRCH workshop for Working Group 2 on quality and sustainability of herbal medicines was organized as a virtual meeting by the Working Group Lead, China. An enormous thank you must go to the leads, India and China, for their efficient organization and leadership in the respective areas. As I've already alluded to, working groups are the very lifeblood of the IRCH. What they discuss can become the common agreements of IRCH and potentially the position of IRCH and potentially the position of all regulators around the world that culminate within this formal network. Working groups are intended to be the active pulse of the network, allowing for exchange of information, new positions, and discussions of challenges amongst like-minded regulators. We cannot underestimate the importance of these structures to this network, and I congratulate WHO and all members here for initiating those working groups as a very important milestone in the life of IRCH. I must mention that one of those important events I alluded to earlier was that the WHO and Standard Control Organization, SADISCO, of the Ministry of Health and Family Welfare of the Government of India hosted the 19th IRCH conference last year, funnily enough from October the 14th to October the 18th, which is exactly the same dates of what it is that we are participating in IRCH this year. A session on traditional medicine and herbal medicinal products was held during IRCH, and it highlighted the growth of IRCH in a presentation which was delivered there, which indicated that originally there were 13 founding members of IRCH. This is reported at the time in 2024 to have grown to 49, and we will hear today how that has grown even further. This, together with a number of policies and growth of regulation of herbal medicines by WHO, and the potential for IRCH to play a considerable support role to all member states. This was the first time a dedicated traditional medicine session was held in IRCH since Cape Town, South Africa in 2016. The next major event took place, as Dr. Dewar has alluded to, in May 2025 with the passing of the WHO Traditional Medicine Global Strategy 2025 to 2034. With again the specific mention of regulatory efforts pertaining to traditional, complementary, integrative medicinal products. I must point out, as I did in the steering group meeting last night, that it's not just the inclusion of regulation of traditional or complementary medicine products that we see again, but very specific wording that's included in the rationale and the directions which will guide us. Wording such as appropriate regulatory mechanisms, safeguarding the public from unsafe and substandard TCIM products, a risk-based regulatory approach, tailoring regulatory requirements for specific TCIM products, establishing appropriate participatory mechanisms, quality control standards, labeling requirements, ensuring that the intended use is justified and rational, and the highest standard of science, stringent regulatory principles as appropriate to national requirements in order to ensure the safety, quality, and effectiveness in their clinical settings. That perfectly encompasses the very role of a regulator, and that is what it is that's within the WHO global strategy. This group, this formal network, has an incredibly important role to play over the coming 10 years in order to fulfill that objective and that rationale and that strategy, that element of what is a global strategy. With that, there are 6 actions for member states which everyone should be well aware of and already working on and benchmarking in their own contexts, and that's what it is that we will open up for discussion over the course of the next few days, whether it's formally or informally. A key task of all member states will be to determine what those actions are and see where it is that they are positioned themselves. Some member states may well have achieved those actions already. Some may be on their journey. Some may not have even started. But again, that is the beauty of this network. That is why it is that we exist, is to be able to help one another to achieve those actions, to achieve those milestones, but also improve what we are currently doing. And so the sharing of information, the discussions, the culmination of technical requirements are incredibly important. In this respect, members of WHO, IRCH, I call upon you to engage with other regulators in your respective immediate regions as well. Attempt to make contact with 2 other regulators that are not already members of IRCH and provide them with the information of how it is that they could become members by contacting headquarters. This will expand the reach of IRCH and provide for a great collaboration and depth of information across all of us. Imagine how long the meeting would have to be, Dr. Dewar, if we had 100 members that had to give feedback on what it is that took place in the last year for their regulations. Already we are on 50 members. If we recruit 2 members each, we're going way beyond the 100 that would be the objective already outlined. The annual IRCH meeting provides us with this opportunity not only to discuss formal matters on the agenda, but to meet in person on matters of common interest. All IRCH members must feel free to raise any matter that they would like discussed and to see what it is that would be put on the agenda of working group workshops, as well as the annual IRCH meetings. Please also feel free to seek out other means of engagement with one another. The most important elements of this network are the friendships that you make, the ties that you make, the opportunities to exchange information during the year between each other on particular challenges. And I encourage you to meet as many people as possible. There is nothing more invigorating than discovering like-minded people with similar challenges and possible successes you could emulate, learn from, or contribute to. This is the very spirit of IRCH. An important element about IRCH and its activities arose just yesterday at our steering group meeting. Importantly, this group must find its voice, making declarations about the importance of the regulation of herbal medicines, contributing to their safe and efficacious use without compromise on quality. The importance of regulation must be made known to members of the public and to political leaders around the world. Your participation, your voice, and emphasis are critical to forming this position and the success of this group. And I thank you for your engagement and time spent with us over the course of the next few days. With this in mind, colleagues, the 16th annual IRCH meeting is now declared open. On behalf of all IRCH members, I therefore invite Dr. King Song Chol to provide his opening remarks and keynote address as well. Thank you very much.
Okay.
Thank you so much for Dr. Dua and Mr. Neil Gower for your inspiring and soulful remarks. Ladies and gentlemen, for the next, we would like to invite the chair of WHO IRCH, Dr. Kim Sung Chol, to deliver the opening speech. The floor is yours.
Dear Professor Taruna Ikrar, Chairperson of the Food and Drug Administration, Government of the Indonesia. Dear Dr. Neil Gowa, Vice Chair of the IRCH Network. Distinguished participants, ladies and gentlemen, a very good morning. Selamat pagi. Okay. So warm greetings from WHO, World Health Organization. So at the outset, I'd like to extend a warm welcome to all the dignitaries of the Government of Indonesia and esteemed regulatory authority, and also renowned researchers, academicians, representatives of WHO member states, and also that worthy steering group members of the IRCH, and esteemed WHO colleagues from WHO regional office and country offices, and organizer to this 16th annual meeting of the WHO International Regulatory Cooperation of the Herbal Medicine. Today I'm told that the 59 participants from the 19 WHO IRC members are joining in person today, and also 31 participants are joined or online today's the meetings. It is very heartening to know that those enthusiasm from all the stakeholders to discuss the status of the regulation and also challenge and the way of the forward for augmenting the quality, safety, efficacy of the traditional medicines across the globe. For the benefit of the new members and observers in WHO IRCH network, I'd like to recapitulate. IRCH network was established in 2006 with a mission to protect and promote public health and safety through the improved regulatory regulations that for herbal medicines. So in 2017, a traditional complementary and integrated medicine unit in WHO headquarters became the secretariat of the IRCH network. So membership of WHO, IRCH is open to all any national regulatory authority and regional and subnational sub-body engaged in the regulation of the herbal medicine. So I think over the years, WHO IRC network has become, has grown, and the 49 members across the 6 WHO all regions. So during the next 3 days, we are looking forward to achieving 2 main objectives. First is to review the status of the regulation of the herbal medicine in IRCH member states, especially from the perspective from the progress that we made since the 15th annual meeting. And secondly, we are going to learn from the experience and expertise of the WHO IRCH members regarding the issue pertaining to the quality control, safety, efficacy of the herbal medicine, and also way forward for the WHO International Herbal Pharmacopoeia, as well as the WHO Global Benchmarking Tool for evaluating the national regulatory authority for traditional medicine products. As you know that ever-changing spectrum of the lifestyle disease and also exponentially growing pandemic of the NCD has reiterated need to validate integrated approaches to the health and well-being. We have noted there is a growing recognition of the traditional medicine role in complementing the biomedicine to address the emerging health challenges. As we recover from the COVID-19 crisis, we are witnessing renaissance in the appreciation and integration of traditional medicine across the globe. As you mentioned, some of our speakers, resolution of the 20 adopted during the 76th World Health Assembly in 2023 requested Director General WHO to develop the new global traditional medicine strategy 2025-2034. So to identify the key priority to be addressed in the new global traditional medicine strategy, WHO has conducted that third global survey in 2023, which has revealed that 170 member countries acknowledging use of traditional medicines, and among which 116 countries have established national regulatory framework and policies for traditional medicine products. Therefore, 78th World Health Assembly in May of this year has unanimously approved the WHO Global Traditional Medicine Strategy 2025-2034. So realizing the need for integrating evidence-based traditional medicine into national healthcare system, this strategy is a quite unique, pragmatic, and also augment the focus from the traditional medicine to the traditional complementary and integrative medicine. So this strategy focuses on 4 strategic objectives, including the research and evidence, and regulation, and integration, and cross-sector collaboration to protect the health and well-being of the people and planet. I'm so happy too that IRCH network has been able to accomplish those recommendations of the 15th annual meeting, which was conducted last year in Istanbul, Turkey, where it was recommended organizing workshops to contribute regulatory capacity building among the member states. So during the August, the government of India organized the 3 days training programs to the WHO members as well as observers in the Pharmacopoeia Commission of the Indian Medicine and Homeopathy in hybrid mode. And also that, that workshops as covers that, that topics under workshop working group 1 and 3, which including that safety and regulation of the herbal medicine, as well as the efficacy and intended use of the herbal medicines. Similar, the online training program was organized for 2 days on the working group 2 on quality control, standardization, and sustainability of the herbal medicine by the government of China in the National Institute for Food and Drug Control, Beijing. I'm sure that the trends of the learning from each other's experience will not only continue, but also will be amplified in the future, in the years to come. So dear friends, to progress in the direction of the achieving universal health coverage and health-related sustainable development goal, there is an urgent need to agree on the robust methodology for identification, standardizations, and preclinical and clinical study, as well as the post-marketing surveillance of evidence-based traditional medicine. So I strongly believe this IRCH network provided the platform to discuss all these issues. Therefore, I'm really looking forward to a fruitful interaction and healthy discussion and tangible recommendation from this 16th annual meeting of the IRCH network. And also that on behalf of the whole WHO IRCH members, I'd like to extend our deepest gratitude to the government of Indonesia for their support and hosting this meeting in such an elegant manner. And also, I wish you all this most productive and inspiring meeting in the coming 3 days. And also, thank you very much, and terima kasih. Thank you.
Thank you so much, Dr. Kim Suwal, as the chair of WHO IRCH and also head traditional, complementary, and integrative medicine TZI unit, WHO headquarters, Geneva, Switzerland. Ladies and gentlemen, for the next, we proceed to the speech from the chairperson of the Indonesian Food and Drug Authority. With the great honor, we would like to invite Professor Taruna Ikrar, MD, and Biomed, PhD.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, everybody. Distinguished Dr. Sukol Kim, IRCH Chair. Also Dr. Nell Gour, IRC Vice Chair. Also, Dr. Ong Kyung Hang, Technical Official for Traditional Medicine, World Health Organization, Regional Office for Western Pacific. Professor Roderick Layung Lengga, my colleagues, team lead for the health system of WHO Indonesia. Dr. Anda Lucia Rizka Andalusia, apotheker, Director General for Pharmaceutical and Medical Device in Minister of Health, Republic of Indonesia. Professor Dr. Ari Yanuar, MSI, Dean of Pharmacy Faculty of the University of Indonesia. Professor Yahdiana Harhab, Dean Faculty of Republic of Indonesia Defense University, Professor Dr. Dewi Melani Haryadi, Dean of Pharmacy Faculty of Airlangga University, Abdul Rahim PhD, Dean of Pharmacy Faculty of Hasanuddin University, also representative from Minister and institution, Team WHO Traditional Complementary and Integrative Medicine Unit, delegate from IRC member country and observer country, colleagues from Minister Association and University, participants, ladies and gentlemen. Today, I really honor stand in front of all of you. We know that today is from sincerely thanks for WAR steering group in the Secretariat of W headquarters entrusting us with the opportunity to host this important meeting. A special welcome extended colleagues from Traditional Complementary Integrative Medicine Unit Regional Office, and all of from you today is show us that today is, I heard from the host, especially from Pak Kasuri, he said that from the member of IRCH is about 48 countries, and today we attend 24 countries. It is an important meeting to show us that belonging to the traditional medicine, especially in Indonesia, I just want to announce one article published in Nature. 30,000 or 31,000 years ago. Can you imagine where us when that time? In west of Borneo, there is surgical amputation. And this report published in really top #1 prestigious journal. His name is Nature. When that time, there are surgical amputation with the left leg, and the amputation is success. How to measure the successful? Because this person after amputation is survived 9 years and living after amputation. And inside our mind, so thinking about that, how this person can survive. As a physician, as a doctor, I really understand surgical, especially for the amputation, is really not easy. It's very tough because you need to understand about the anatomical, you need to understand about the physiological, you need to understand about structure of the neuron and nervous system, structure of vascular system, structure of lymphatic system, structure bone, etc., etc. So many going on. That's why in the orthopedic surgery, if you want to learning, to studying how to do some amputate the patient, long journey. At least you need to have training about 15 years to do this procedure. But this procedure is 31,000 years ago, and the person is alive. And scientists believe this person can survive because the powerful of herbal medicine, the powerful of traditional medicine when that time. It means from long journey of history of Indonesia, is about 31,000 years ago, we already saw up in this country, in this continent, in this area. They are a procedure medicine, successful to treat the people and to protect the people from something, for example, a secondary infection by using herbal medicine. So, moreover for that, they are specifically based on our research and National Innovation Agency of Indonesia. We are very wealthy biodiversity in this country, in this continent, in this area. We have it more than 30,000 species plant has potentially to use it for traditional medicine or for herbal medicine. Meaning we have a lot of resource, we have a lot of things we can procedure for our development, traditional and herbal medicine in Indonesia. But one thing, the problem is, based on the Indonesian, we also saw that 18,000 type of the original traditional medicine in Indonesia we have it. 18,000. But from 18,000 to be standardized is the herbal medicine in Indonesia, we only have record only 71. Means still a lot of opportunity to develop herbal medicine, to develop traditional medicine, to standardize them. Because to standardize, you need preclinical study. And to add clinical study, this traditional standardized medicine can become phytopharmaca, equally with the drug. And we only have it 20. Can you imagine from 31,000 years ago? And we have it species more than 30,000. And we have it original medicine is 18,000. And the standardized only 71. And become equally with the drug only 20. Mean long journey to go there, because this is really our wealthy, our rich, very rich resort. So to do that one, to develop this, Indonesian Food Drug Authority proposed the concept, very easy concept. We say the ABG concept. Academia, business, and government collaboration. Why we want to propose this one? First, this wealthy potentially we want to develop. We want to, like they investigate a new drug, to develop them, to do research, to investigate that, to be standardized and to be drug. Equally with the actually modern drug. Meaning, need research, need study, need a lot of standardized. Because of that, the first academia is the right place to do that one. And Indonesia, we have it, 4,000 campus. But I believe for 4,000 campus in Indonesia, at least there are 500 top. The 500 top, currently we already have collaboration with the BPOM, is about 170 campuses, include the very top university, for example, University of Indonesia, Institut Teknologi Bandung, Gajah Mada University, Airlangga University, Hasanuddin University, and Pajajaran University, and so on, so on. We, Institut Pertanian Bogor, We have it already 179. Why we want to propose in campus? Because the campus is a lot of resort, thinking out the box, and also a lot of innovation there. Why? Because everybody inside the campus have huge, a big pressure by the dean, pressure by the president university, pressure by the faculty to thinking out the box, to have, we say, innovation. Very wealthy innovation inside the campus, thinking out the box. But the problem, the limitation in campus, very limited financially, very limited facility. Another side, like the business, currently for the pharmaceutical industry, we have 272 industry manufacturing medicine, and for the traditional medicine, we already have 1,100 industry. It's meaning the industry side always thinking about the business, profit, and profit. Means a lot of money in the business side, but has limitation about innovation, because the way they thinking how to have the profit. But the industry has a lot of things. First, enough financially, even more financial, more money there, also has more than good the facility, because they need, we say this, good manufacturing certificate. They cannot get good manufacturing certificate without good facilities. It means a lot of good facility in business. So we have imaged more than 30,000 herbal can potentially become drug, and still very long journey to be standardized medicine only 71, and to be drug only 20. It means a lot of potentially we do research if we combine together between academia and business, will be very benefit for Indonesia, so benefit for the around the world, because a lot of potentially by investigate, by research, by doing research and by doing investigate, can be potentially thousand potential herbal medicine can be available in near future by we push them to do research, to investigate a new drug investigation. I mean, what the point for the government side, especially the Indonesian Food Drug Authority? Because all of them, they need our certification, they need our approval from the clinical study until approval to be medicine, marketing authorization, etc. Meaning, if we collaborate with three angle this, our three helix between academia, business, and government, in this side, for example, is the Indonesian Food Drug Authority, we believe it, in near future, a lot of herbal traditional medicine can be available, become standardized herbal medicine, can be phytopharmaca. And I believe this can help the people wealthy. Thousand years ago, we can use it this time, can be available. I mean that I want to propose this idea, and I believe in this meeting, WHO IRCH group meeting will be very important for us. So I appreciate your attention today, and distinct and excellency, I really, on behalf of the Indonesian government, believe it that this meeting will be very valuable for our community, not only for Indonesia, but around the world. Because speak about the traditional herbal medicine, based on the last year economy, that is more than 500 billion US dollar is market sharing, meaning this is really is a huge company to help the people, but another side also to create, to develop and support the economy grow. So I wish this meeting can be successful and reach a lot of benefit for all of us. And I really appreciate for your attention today. And thank you very much to coming and to participate in this meeting. And thank you for your attention. Billahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Prof. Taruna. Please kindly remain on the stage. For the next, we would like to move for opening ceremony of the 16th WHO International Regulatory Operation for Herbal Medicine Annual Meeting 2025. So, ladies and gentlemen, for the symbolist, the opening ceremony, let us begin by playing the angklung together. The ceremony will be led by Prof. Taruna Ikrar. So, we would like to invite Dr. Ki Sungchol to come to the stage. And for the next, Dr. Nel Gower, Dr. Ek Yun Han, Mr. Roderick Salenga. Kami juga turut mengundang untuk bergabung naik ke atas stage Bapak Muhammad Kasuri, Ibu Rizka Andalusia, Profesor Ari Yanuar, Bapak Abdul Rahim, Prof. Yahdiana Harahap, Prof. Dewi, Dr. Insinyur Hans Saputra, serta Insinyur Alfredo Sani Senat. Once again, for those whose names are mentioned, please come to the stage. Let me give us a short explanations about this traditional instrument. Angklung is one of Indonesia traditional musical instrument and it will sound when being moved. Ladies and gentlemen, for this session will be led by conductor. So please give your attention for all the conductor. Dan jika Bapak Ibu ingin mengabadikan momen hari ini, kami persilakan untuk mengabadikan menggunakan phone, mobile phone masing-masing atau kamera masing-masing. Untuk Bapak Ibu yang berada di atas stage, for all distinguished guests on the stage, please give your attention to the conductor. He will give a sign to play the angklung. But first, we will be led by Prof. Taruna. As the leader of this ceremony, Prof. Taruna, are you ready, sir? You ready? Right. Ladies and gentlemen, for the opening ceremony of the 16th WHO International Regulatory Cooperation for Herbal Medicine Annual Meeting 2025 will be opening in 3, 2, 1. Ladies and gentlemen, with this, we officially open the event. And once again, welcome to the 16th WHO IRCH Annual Meeting 2025 for strengthening global collaboration for herbal medicine regulation. So please kindly stay on the stage. Bapak Ibu yang berada di atas stage, tetap berada di atas. Dan kami mengajak untuk seluruh hadirin hari ini, kita akan memasuki prosesi selanjutnya. We have another agenda coming in, that is a drinking jamu ceremony. Kami persilakan kepada Bapak Ibu hadirin sekalian untuk bergabung bersama. Jamu is a traditional Indonesian drink made from herbs and spices known to be good for your health. So please, ladies and gentlemen, for all the participants and delegates, please stand up and rise your jamu drink up. Bapak Ibu kami persilakan untuk berdiri semuanya. For all participants and delegates, please up. Please stand up, ladies and gentlemen, and please rise your jamu drink up. Bapak Ibu, kita akan sama-sama melakukan prosesi minum jamu bersama. Ladies and gentlemen, you ready? Let's come together in 3, 2, 1. Enjoy your drink, the traditional jamu from Indonesia. Please come and join with us. This is the jamu, ladies and gentlemen. Thank you so much. Please kindly stay on the stage. Ladies and gentlemen, for all the participants, kami persilakan kembali duduk. You may be seated again. Dan selanjutnya kita akan mengabadikan dengan foto bersama. We would like now invite all delegates as representative each country to come to the stage for a group photo sessions. And I would like to invite from WHO Emerald to come to the stage. For next, WHO Senegal, WHO Comoros, and delegates from Sri Lanka, Thailand, India, Malaysia, China, Brunei, Japan, Saudi Arabia, please come to the stage. Iran, Botswana, Comoros, Ghana, Brazil, Cuba, Bhutan, Hong Kong, South Africa, Senegal, Tanzania, Zimbabwe, Sestama. Kami juga mengundang Inspektur Utama, Deputi 3 Badan POM dan Deputi 4 Badan POM. Kita akan berfoto bersama, ladies and gentlemen. We would like to take a picture together. Is every time you ready? Alright, please give your attention to the camera. The first camera, please raise your hand. Okay. In 3, 2, and 1. All right, we're gonna to move the second pose. The second pose is we'll be holding hands like this. You can to do like this, ladies and gentlemen. Right, we will be prepared. Just make sure you still to give your big smile in 3, 2, 1. Thank you, everyone. Thank you so much. You may to go back to your seat. Please hold on, ladies and gentlemen. Ladies and gentlemen, for the closing this ceremonial event, we will to take a picture together. You just have stay on your table. The camera will be from the stage. Kami persilakan untuk kamera naik ke atas stage.
So ladies and gentlemen, you are all requested to come on the stage for a collective group photo. Representatives of all the WHO IRCH member states who are here, you are all requested to come on the stage and let us all have a group photo in the presence of the dignitaries. You are all invited on the stage. Please come.
All right.
All those who are here to attend the meeting, please come.
All right, we're going to take a picture for the second photo group session. Please, for all the representative delegates to come to the stage once again. With a warm welcome, with the highest respect, please, for all delegates to come to the stage. Thank you. All right, once more, please, to come to the stage. We're going to take a picture as the moment with the button palm. Alright, just from all delegates, Bapak Ibu, kami hanya mengundang untuk delegasi. Nanti kita akan berfoto bersama di meja masing-masing. Alright, nanti kita akan berfoto bersama Bapak Ibu. Kami persilakan untuk berada di tempat masing-masing. We just have to take a picture with representative for all delegates. For cameraman, photographer, you ready? Ladies and gentlemen, every time you ready? All right, hold on. Hold on. All right. Are you ready in 3, 2, and 1? Give your big smile. Once again in 3, 2, and 1. Thank you so much. Right. We're going to take a picture from your all table. Bapak Ibu silakan kembali ke tempat. You may go back to your seat. Kita akan berfoto bersama di tempat masing-masing. Kita akan wifi Bapak Ibu. Kami persilakan untuk kameramen berpindah naik ke atas stage. We have one photo session. Again Bapak Ibu. You just have to stay on your table and the camera will be lit at the stage. So, you may be seated, Bapak Ibu. You may be seated, ladies and gentlemen. Once again, we want to take a picture from the stage. All right, for a photo session, you may to please all to stand up. Bapak Ibu silakan berdiri, kita akan berfoto bersama untuk mengakhiri rangkaian hari ini. Ladies and gentlemen, please all stand up and give your attention to the camera and of course for a big smile for 16th annual meeting of World Health Organization International Regulatory Corporations for Herbal Medicines in the 3, 2, 1, right? Thank you so much, ladies and gentlemen. You may be seated. Please give a round of applause for all of us. Thank you so much. For Prof. Taruna, please kindly move the exhibition area. And also Dr. Kim, please to following us. We will now begin the officially ribbon cutting, marking the symbolic opening of the International Dermatology and Aesthetic Expo, IDEX 2025. The ribbon cutting will be witnessed by all distinguished guests and delegates who have joined us. All right, we're going to moving on the cutting ribbon. Baik Bapak Ibu, kita akan bergeser terlebih dahulu untuk sama-sama melakukan opening ceremony pembukaan dari IRCH 2025. So let this greeting be filled with meaningful decision, inspiring insight, full collaboration.
Good morning, ladies and gentlemen. Right now, it's a refreshment break. So for the coffee break, you can access it in the foyer. Please back
Symbolic
to the
moment.
meeting room.
And now I would like to invite for the exhibition area and visit the fair booth. Ladies and gentlemen, we have come to the end of the agenda. Thank you for your kind attention and participation. We'll see you and enjoy the refreshment, and please visit IDEX 2025 and continue with your perspective group meeting, and thank you.
Okay.